Welcome back to the Poultry Podcast. In today's episode, we're walking through one of the most powerful tools backyard keepers have, the hands-on physical exam. Knowing what's normal and catching subtle changes early can mean the difference between a minor issue and a major loss. I'll show you exactly what to look for and how to turn routine checks into real prevention. If you find this content valuable, visit thepoultrydoc.com for more articles and videos on similar topics. Let's get started. Welcome back to the Poultry Doc Podcast. I'm your host, Dr. Blayne Mozeshek, and today we're going to do a little bit of a physical exam. So we've talked about the best way to objectively measure your bird's health is weight. That's one way we can look at it. Obviously, another good way to do it is just physical exam. And so we're going to walk through how to handle your bird, what to look for from head to toe. And today we're at a special guest. Miss Rachael is going to join us, and she's relatively new to chicken keeping, and so I'm going to help Rachael. We're both going to walk through what to look for as you work through from beak to tail, really, and what to look for in these birds just to make sure that they're healthy. So first off, holding them, right? And so there's a couple ways to do it. There's like the football approach, which I've always support her breast with, I'm right-handed, so I keep her in my left hand. Another way to do it, if I need to do my left hand, again, supporting her under the breast that way, and that way I can look at her wings and do all that sort of stuff too. So Rachael's got a good hold on Elizabeth Taylor. Yes?
Yes.
I think we've got Elizabeth Taylor there, and this is Jailbird, so to introduce our hens of the day. So again, we'll start from the beak and work our way back. So we get many comments about potentially cracked or broken beaks. It's obviously it's an easy thing to see, right? So we can take their head, we can see they don't necessarily like it, so they may shake and try to get away. The more they try to fight, it's a good sign, right? They're healthy and want to get away. But yeah, take a look at the beak. There shouldn't be any cracks or chips. Sometimes we can have slab fractures of the beak that can happen. Both of these are really nice, and this is a good way to evaluate that. So one of the main insights into bird health is what, Rachael?
I have no idea.
What is the window to their soul?
The window to their soul.
Their eyes.
Oh.
Their eyes. So really the eyes are one of the key things you can look at in a bird to tell if there's something going on, at least early. If you see a bird, usually another thing to point out too, always take note of what's normal, right? If you're going through your birds, you want to notice how they breathe, how deep they're breathing, how many times they're breathing per minute, like get respiration. And you really hardly should be able to see that they're breathing, but if you can, take note of that. If you see them breathing differently, that can be a sign, right? And so we'll start with the eyes. Chicken eyes should be almost perfectly round. They should be bright. They should be clear. If you start to see them sort of squint, we call it like an almond eye sort of shape, that's a sign that they're not feeling well. Obviously, if they're roughed up and the feathers aren't in great shape, they stop preening themselves. So if they're not really pretty and bright and their feathers aren't being well maintained, that's another sign that they're not feeling well or getting off. So again, the eyes are really important. Obviously, there's drainage and other things. Foamy eyes or bubbles in the eye, that's a really telltale sign of respiratory disease, so that's always something that we want to be on the lookout for. Another thing, and we've talked about it in other videos, is the nares. Do you remember?
The nares, their little beak, their nose.
Yeah, so they have their nose, essentially their nares, right, is a little hole where they breathe from when they're not open mouth breathing. And if they're just like us, we can have a runny nose. The chickens can get a runny nose too. And that fluid will come out of the nose just like it does with us, except we're not pecking in the soil and the bedding. And so chickens, since they'll get that runny nose, it'll get dirty. So you'll see dust or mud accumulation around the nose. That's kind of one of the first hints at an early respiratory challenge. It's just the nose gets dirty or the beak gets dirty. If you have a white bird, it'd be hard to see in these two because they're dark. But if you have a white bird like a leghorn with that runny nose and dirty beak, one of the first things you'll notice too is the wings. When they'll wipe that beak on their shoulder, and you'll see this dirty stripe on either side. And that's a kind of another classic sign that potential respiratory issue going on. So that is looking at the face. Obviously the comb, many people
make note of the color of the comb and wattles. It's not really high on my list of things to like, I'm not, if I see a pale comb, I don't immediately jump to some issue, right? Because there are a lot of things that can influence comb color, sexual maturity being the obvious one, but many people will say, oh, it's a pale comb, it's a potential worm challenge. I don't necessarily make that direct correlation. Obviously, we've talked about too in the past, the best way to do that is through a fecal flotation and actually look for the worm eggs. So another thing, as we work our way down, we get many comments about the crop, right? So the crop, many people think, I've got enlarged crop or crop stasis.
Yeah, what is sour crop?
Yeah, sour crop. So sour crop is...
Let's get a quieter one.
Okay, quieter.
So we can hear.
Are you gonna ask me again?
Yeah. What is sour crop?
What is sour crop? Okay.
In like a short version.
Short version. Okay, so sour crop is basically when the chicken is eating, right? It's taking in carbohydrate, whatever, eating off the ground, and not digesting properly. So the crop is supposed to be continually feeding the stomach, and when that stops to happen, we get yeast that starts to grow in the crop. And that can especially happen with birds on antibiotics, right? Because antibiotics don't control yeast, and they actually kill good bacteria and bad bacteria. And so we can see yeast overgrowth with the presence of antibiotics, with the use of antibiotics, because actually there's good bacteria called lactobacillus. They produce lactic acid. They keep yeast in check. And so that's one good reason why we shouldn't give too many antibiotics. But again, feed passage time in a bird is really fast, and when we have a GI upset, that slows things down, that allows feed to stay in the crop longer and can contribute to some of the things that people refer to as sour crop. So typically, sour crop is going to be a secondary issue to something else. What we really want to do is find out what the primary cause is. So some GI upset could be bacterial, could be coccidia, could be a number of things. It really just depends on the bird's age.
Okay, so if they do have sour crop, how do you know?
So ideally with sour crop, one of the things we'll have on the e-commerce site is a gavage tube, basically a feeding tube. Whereas we use that tube to feed birds, we can also use it to take a sample of the crop and take a sample of the material in there, or the fluid. And it's easy enough to just put it on a slide and you can actually see yeast cells really easily. And there should be some, we wouldn't be surprised to see some. If there's like too numerous to count would be the definition, then that's what we would call sour crop. So.
What about just backyard owners? Is there other signs?
Yeah, I think most backyard owners are going to jump to treating just if they see fluid in the crop. Again, my recommendation would be to figure out what the actual original issue is, and the yeast will resolve itself. So whether that be like a GI upset or something that we need to control there.
Can you feed them yogurt with the antibiotics like people do?
Yeah. So yogurt, you hear me talk about it, and I know somebody posted a paper from Bangladesh about the effects of yogurt in birds. Really, yogurt, birds don't produce the enzyme to break down milk, right? They're birds. They never evolved to take on milk, to drink milk or eat milk or whatever. So they don't have the things that it takes to break it down. So it causes GI upset. Yes, yogurt has less lactose than milk does, but it's still there, and there are other things, right? So any sort of probiotic would help, and a poultry-specific probiotic would help replenish those bacteria in the crop. So that's probably the best way to actually resolve it, is to reintroduce like lactobacillus bacteria that are going to produce acid, like lactic acid, and that in itself is a natural way to control yeast. So that's going to be your best approach.
Okay.
So we've talked about the crop. Where are we moving on to next? Any other questions?
No, not at the moment.
Not at the moment. Okay, so this is a great opportunity, like look at her wings, right? You can look at her wings or under the wings, both of them. So she'll probably fight a little bit, but this is a good opportunity to like stretch things out. Look, you can look for, if you're concerned about mites, another good spot to look for them. Look under the feathers, under the wing. Just again, all the plumage in general, we want to go over and look for any bald spots. If you do see bare spots on her skin, depluming mites could be one thing. With depluming mites, we see really irritation of the skin, so you'll see redness and flaking. The flaking is sort of a better giveaway than just trauma. Another good one is, we talk about fleshing a lot. You know what I'm talking about?
No.
So as I'll say on the forums, somebody's, had a hen, it looks like it's been going on for a while. I'll ask about her body condition. Has she lost any condition? So what I'm asking for there, what I want to know is has she lost weight, right? And a lot of people aren't weighing, but you can get a real good feel or a good sense of how much condition they've lost is how prominent the keel bone is. So in her case, like we're supporting her by her breast. Mm-hmm. These are young pullets, so they're not going to be well fleshed out. They're not going to be, they're still, again, relatively young. They're not fully grown, but her keel bone has obvious muscle around it. And if I would make the analogy, it's more like a sharp triangle at this point.
Where's the keel bone?
So the keel bone is her breastbone, right?
Oh, okay, what I'm holding.
Yep, so you should feel it right in the palm of your hand the way we're holding her. And while you can definitely feel that in her, you'll notice that there's muscle on either side of it. It's not just a bone. Birds and people, everything it works, they'll burn sugars first, usually like stored in the liver, glycogen. Then you're going to start burning fat, and then kind of last resort, you start burning muscle, right? And so she starts basically degrading muscle for energy. And in birds that are really sick, you'll feel essentially you're just feeling bone, really, that keel bone, hardly any muscle left. Once birds get to that stage, it's really difficult to get them back. So again, it's another reason to handle your birds frequently and, feel for confirmation and sort of make sure we're not feeling that breastbone and there's plenty of muscle there. And eyes are bright and all the things.
If you start feeling the breastbone, is that indicative of certain things that you could put a stop to without seeing of it?
Yeah, I think that's, we could get in front of things. So if you handle your birds relatively often, one, we always suggest weighing, right? That's a good objective measure of what's going on. If you're doing that and you're feeling that breastbone, we should start to see a decline in weight, I would expect to. Really, if we see a decline in weight, there's something going on. So we want to jump on that relatively quickly to figure out what's going on. Is it, again, we can run some diagnostics. We can see, is there a GI issue? Is it a cocci issue? Or is it maybe it's associated with some respiratory noise and it's a respiratory issue that's knocking them down. We always want to get in front of it before it gets too late, before we lose so much.
All right.
Yeah. That's another thing, most of the time when people are coming to the forum or maybe they finally make it to a veterinarian, it's like, it's been weeks and it's like, it's really too late. It's something that, if you have your dog and the dog's not acting right or maybe hadn't eaten in a couple days and maybe it's got diarrhea, you don't wait 2 weeks until, Bailey can walk anymore. So there's really no difference here. We want to get in front of those issues and try to get them taken care of as soon as possible. And I know, poultry vets can be hard to come by. So obviously we're doing our best here at the Poultry Doc to try to help. And we'll have more services like that coming to you soon via telemedicine. But just something to keep an eye on. We always want to get in front of those issues before they get too advanced. So we're going to move on to the legs, right? And then we're going to keep going back. So legs in this case, bumblefoot is a big one. And we talk about it relatively often. We've done a couple cases. I mean, from this angle, she's really easy.
I'm scared I'm going to hurt her.
So yeah, if you put pressure on the front of the foot, she doesn't tend to kick as much. So these are normal, healthy feet. They're getting around. They're essentially free range. I'm not too concerned with this. I mean, these aren't perfectly bright and shiny shanks. I'm not concerned with, I've had similar people show me pictures similarly and they think that they've got a scaly leg mite issue. Scaly leg mites are going to present, obviously the shank would be one of the first places we see them, and you actually see the scales start to lift off and really become.
They just have dry legs.
Well, yeah, these are just dry. They need some lotion. I'm kidding, they don't need lotion. Another good, what I would suggest that you do, going back to what's normal, what's abnormal, is just to get an idea of their legs. So you can crank on these a little bit just to feel, you may have, and I'm saying this because there may be some trauma or some other instance that happens and you're like, does she have a broke leg? So try to feel what normal feels like. I mean, these joints in chickens are tough and their legs are pretty stable. So when there is a fracture, this leg is easily recognizable that it's broken. And whether it's like the femur or the tibia, fibula, again, it's really, there's no doubt that it's broken. And very rarely, I can't honestly think of a time where I've seen an actual true dislocation of like a femur, for example, and then the hock is pretty fixed. So early on, we can see like genetic, inherent abnormalities after hatch, but once they get older, it's really rare to see any sort of dislocation of that. Fractures do happen though.
Okay.
So the back end, you can see I've got a good grasp of her legs below or above the hock, and she really can't get away here. So she's very secure.
She doesn't like being manhandled.
This allows me, again, I can look at her feet, make sure everything's good there. I can look at her shanks, and I can, most importantly, like look at her vent area, right? These are young birds, they're in great shape. We're not worried about mites or whatnot, but this is where I would look for like northern fowl mites, for example. You'll see, one, they won't have as many feathers. Two, you'll see those kind of coffee ground grayish looking. Actually on her, since she's black, it'll be more grayish looking. It'll be lighter than her color. But they'll be towards the base of the feathers. A lot of that material is sort of glued onto the feather. If it's lice, those are often, actually they're not as often around the vent, but they can be, but those are definitely white, the nits of lice. You see them around the face, is another good spot for them. And then we just want to look at the vent, especially once they go into egg production. They can prolapse, that happens. The time where that's going to be most important is when they're coming into production, so at around 25 weeks or so. If you're bringing several hens up at the same time and they're all coming to age at the same time, what we usually do is wait for that first egg, and then that's when we kind of start putting hands on birds and doing a better inspection of making sure everybody's healthy and there's no prolapse. And if you see a hen that's hiding away in the nest longer for a couple days, that's definitely something that you want to intervene on and go check out to make sure that there's nothing going on there. But
is prolapse the same thing as egg bound?
No. So prolapse is basically, it's a prolapse of the tissue. So it's like the cloacal or vent tissue is actually, the cloacal tissue prolapsed out of the vent. So you'll see, it's varying degrees, right? So you can see just a little bit of tissue coming out where it's like pinkish colored tissue, and that's a good sign, right? Pink is good. It's when it starts turning dark and gray and black. That is a bad sign. And so usually if it's gone that far, we've got necrosis or the tissue's dying. It can also continue to prolapse, and we can have cannibalism in the flock where I've actually seen, where other flock mates will continue to peck at that wound and actually like disembowel the bird. So it can get pretty bad where they, do a lot of damage. Obviously, a bird can't survive with that degree of trauma. So we always want to make sure that in the case you do find a bird that has a prolapse vent, even to the mildest degree, we want to separate those, keep her in a dark, quiet area that's warm. You can keep her by herself. This is one of the cases where keeping her by herself is going to be good. Give her a day or two to rest. Actually, just by reducing the light, keeping her in a truly dark room, will sort of shut down her egg production. Just from a stimulation standpoint, the light goes away and they're kind of less likely to lay. The other way to do that, in an extreme example, like if there's a really, and you've got to balance the pros and cons of this, but if it's a severe prolapse and we really just need to stop her from laying for a day or two, is to really restrict water. She has to have water to lay that egg. And again, this is like an emergency scenario. You wouldn't do this on every occasion, but if we have to get her to stop laying and we don't have access to a vet, if we highly restrict her water, cut it by to 10% of what she would normally lay, so just a little bit a day, probably just in the morning, and then again, she will stop laying. Physiologically, she can't lay without water, so she's going to divert water to stay alive rather than produce an egg. So again, that's an extreme example where you need to do that, but you can do that. If you do have access to a vet and you do have a prolapse issue in a hen, vets can do what's called a vets will do a stase suture. God, I can't say it.
Do you want me to say it?
Yeah, talk to me.
A stase suture?
Yeah, I can give a stase suture.
Okay.
Oh, say it. Okay, yeah, so we can put stase sutures on either side of the vent and mechanically keep it closed to keep it retracted. The downside of that is they're going to try to continue to lay or could continue to lay and then put pressure on those sutures and tear the sutures. So that brings on its own set of issues too. So
I've read people put sugar or Manuka honey on a prolapse bed.
Right. So part of that is, when any tissue becomes inflamed, there's like fluid in it. That's what causes the swelling, inflammation. Manuka honey or sugar salt acts the same way. Obviously, we don't put salt on a wound, but you can like put salt on a slug and dry it out. It's the same thing. If we put sugar, in this case, sterile medical grade Manuka honey, that super concentrated sugar, it draws the fluid out of that lesion, like through the skin.
So could you do that while she's in a cold, or
Yeah.
not a cold, dark place? In a dark place.
Not a cold, dark place.
Okay.
A warm, dark place.
All right, yes.
Not like your heart.
It's true.
So yes, we want to, it's a great idea to apply. One, we want to make sure it stays moist, right? Because if that tissue, it's what we call a serosal surface, so it's actually kind of like the inside of the gut. You want to keep it moist because if it dries out, that's a bad thing. So any sort of, if you didn't have, let's say, the Manuka honey to pull the moisture out, like a water-based lubricant like KY jelly, for example, something to keep it clean and moist. And then if you didn't have that, even like Vaseline or something to help keep it moist. But yes, Manuka honey would be better than sugar, but sugar could also be a substitute as well. And just straight sugar, and because it'll act the same way that sugar pulls the moisture out.
Not sativa. Stevia.
No, not marijuana or fake sugar.
Okay. Get them confused.
I know. So we have gone basically beak to tail. I'm sure we've left out a few things, but for the sake of time.
Chicken checkup.
Yeah. What?
Chicken checkup.
Chicken checkup, yeah. But yeah, we've gone through the basic physical exam, what I would go through looking at a bird on an exam room table. And one of the most important things you can do is putting your hands on the bird, feeling them, and get an idea of, again, what's normal and what's abnormal. One thing to take away, chicken trivia. What is it, Rachel?
Their earlobes indicate what color egg they're going to lay.
Yeah, so if you didn't know this, red earlobes mean
Brown eggs.
brown eggs.
I didn't even know chickens had earlobes.
Yeah, and white earlobes mean white eggs. Usually, it's not 100%, but it's pretty. It tracks pretty well.
Okay.
So next time, Bandit will be wearing some bling on her earlobes and maybe wattles.
Gonna pierce them.
Okay. So thanks for joining us. I am Dr. Blayne and this is Rachael Conley, and we will see you next time on the Poultry Doc Podcast. If you like what you're seeing here, sign up, subscribe, do all the things, help support the channel. It really helps us. So we appreciate it again. We'll see you next time.
All right. How do you think this is going?
I'm trying to make it not so editable.
I appreciate that. I hope it's in focus.